Mwanzo wa ngoma Nyilele, nami nasemaje? Nasema kwamba mwanzo wa taarifa zetu za TV47 matukio awamu hii ya saa 7 ni sasa hivi. Popote ulipo ninakusabahi mtazamaji, nikitumai kwamba Alhamisi yako imekwendea vema. Karibu kwenye taarifa zetu. Sasa imegonga saa 1 juu ya alama hapa Kenya, Uganda na Tanzania. Saa 7 mimi ni wako Andrin Kilemi. Tuandamane sote hadi tamati. Usimamizi wa serikali ya kaunti ya Nairobi ukiongozwa na Gavana Sakaja umefika mbele ya kamati ya afya katika bunge la Seneti ili kujibu maswali kufuatia hali ya afya inayozidi kudorora. Wahudumu wa afya jijini Nairobi wamekuwa wakilalamikia kutolipwa mishahara kwa zaidi ya miezi 4 pamoja na kutopandishwa ngazi katika ajira. Tazama.
Three events, and secondly, Honorable Chair, you can see that the crux of the matter and something that I think this committee should focus on is that response at page 3 saying that all the ICU beds at Mama Lucy and Kenyatta National Hospital and Kenyatta University Teaching and Referral Hospital were full. That is where the problem is, and that is where our focus should be. Governor, there was a development that was going on there for 120 bed capacity maternity building at Mama Lucy. Kindly address yourself to that. And the one that, the neonatal ICU that had been started by the NMS that had stalled, just address us to the current situation of those two projects. And then I think, Chair, we should be able to get some light at the end of the tunnel. Thank you.
I'm sure you remember, even when you were governor, the number of issues on Pumwani, on Mama Lucy, etc. that would come up every week were very high. Chair, we changed first the governance structure of our hospitals to make sure that each hospital is led by a CEO at the level 5, not a medical superintendent. A medical superintendent is good, but their training is on offering medical services. The introduction of CEOs, and you can be a doctor and be a CEO, but you must have additional training on hospital management, on supply chain management, on dealing with human resource for health, on dealing with commodities, and and facilities, how the place is it receptive, what is the best layout. There are many things if you look at hospital management science. And that has given us great success in our hospitals. The first thing I did, I can remove this because I'm not reading. Actually, it was the 20th day after being sworn in, was to set up a health reforms task force that was led by Dr. Olive Mugenda and several professionals of note in HR, Dr. Komunto, in the private sector, Anastasia Nyalita, who is now a CEC, but she was a CEO of private facilities. So there was the owner of St. Mary's, Dr. Frida, to actually come and critically look at the state of health in the city and the facilities and what needs to be done. The implementation of that is what has given us great results. While we regret the death of Wangari, which is regrettable, it is a huge, there's been a big, the numbers used to be very bad. And Chair, one of the things it said that actually embarrassed me, because I was the senator previously, Nairobi County had 0 ICU, 0, before I got into office. There was no ICU facility in Nairobi County, owned by the county government. The only facility of ICU in Nairobi was owned by Kenyatta National Hospital, which is a referral. That is the only public ICU that was in Nairobi County. Chair, in the last 3 years, we have developed, if I count the number of ICU beds that we have, Mama Lucy Kibaki Hospital are 18 beds. Yeah. From there being no ICU, 4 of the main ICU, PICU, which is pediatric, 6, neonatal, 8, from 0. Mama Margaret Uhuru Hospital now has 10 ICU beds. So that is 28. Mbagathi now has 8. That is 8 plus 28. NICU, that are 4, neonatal. And by that NICU has really saved lives because it's where preterm babies born before, the babies that are born before their time. Yeah, and it's the best place I go to because I was also severely preterm. You know, so I go there and I encourage the mothers and I do the kangaroo, which now fathers are doing kangaroo. You know, sitting with the children, and that's from Kibra. Neonatal HDU is 4. Ongoing, right now, we're at 90% to increase another 10 ICU in Mutwini. It's 90% complete. Actually, interestingly, I posted that today. 90% complete. And we are now moved to operationalizing. Now, the ones which we've completed but are not operational. So those are the numbers that we have. It's an improvement. In 60 years of Nairobi, there was 0. In 3 years, we are at more than 30 ICU beds. But how many are enough for 7 million people? We definitely need, there's a gap. There's a definite infrastructure gap when it comes to healthcare in the city that talks about resourcing. We have 7 million Nairobians during the day and 5.5 at night. So even as we do these incremental increases, there is still a huge gap that we need to look at. And that is why, even if you look at the national government stance, while supporting public facilities, also private facilities are seen as part of health infrastructure for this country. It is true that quality control is done jointly by both the national government and the county government. We have a team of quality assurance, and that work is done between ourselves and the Kenya Medical Practitioners and Dentist Council. So we have a role. In as much as health policy in 4th schedule is set by the national government, the county also, because health is the biggest devolved function.
Na mtazamaji, bila shaka ni taarifa ambao bila shaka tunazidi kuifuatilia. Tathmini ya afya utakuwa unaipokea kwa ukamilifu wake kwenye taarifa zetu za hapo baadaye.